What tests are done after a transient ischemic attack? Have you ever wondered what happens after someone experiences a transient ischemic attack, often called a TIA? A TIA is a temporary disruption of blood flow to the brain, leading to stroke-like symptoms that usually resolve within 24 hours. Even though the symptoms may disappear, a TIA is a serious warning sign that a full stroke could occur soon. Therefore, prompt medical evaluation is crucial. When a healthcare provider assesses a TIA, their main goal is to identify the underlying cause and reduce the risk of a future stroke. This process involves several tests and assessments designed to gather specific information about the patient's health and risk factors. Initially, the healthcare provider will conduct a detailed medical history and physical examination. This helps in identifying symptoms and risk factors such as high blood pressure, diabetes, or smoking. They will also check for any previous history of stroke or heart disease and assess for neurological deficits, even if the symptoms have resolved. Next, imaging tests are vital in evaluating the brain and blood vessels. A computed tomography scan or magnetic resonance imaging of the brain is typically performed. An MRI is often preferred because it can detect small areas of brain damage that a CT scan might miss. Vascular imaging tests like carotid ultrasound, computed tomography angiography, or magnetic resonance angiography help visualize the blood vessels in the neck and brain. These tests can identify any blockages or narrowing in the arteries supplying blood to the brain. Since many TIAs are caused by blood clots originating in the heart function and rhythm are closely evaluated. An electrocardiogram checks for abnormal heart rhythms, such as atrial fibrillation, which increases the risk of stroke. An echocardiogram, which is an ultrasound of the heart, can help detect blood clots or structural abnormalities. Blood tests are also conducted to check cholesterol levels, blood sugar, and markers of inflammation or clotting disorders. Depending on the patient's symptoms and risk factors, additional tests may be necessary. A Holter monitor, which is a portable ECG device, can be worn for 24 to 48 hours to detect intermittent heart rhythm abnormalities. Blood pressure monitoring is essential to assess for uncontrolled hypertension, a major stroke risk factor. Clotting tests may also be done to check for blood disorders that increase clot formation risk. The results of these tests play a crucial role in guiding treatment decisions. If significant blockages are found in the carotid artery, surgery or a stent may be considered. If atrial fibrillation is detected, blood thinners might be prescribed. Lifestyle changes and medications to control blood pressure, cholesterol, and diabetes are also commonly recommended. After a TIA, ongoing monitoring and follow-up with a healthcare provider are essential. This ensures that risk factors are managed and any new symptoms are addressed promptly. Personalized medical advice is crucial, as treatment plans are tailored to each individual's specific needs and test results. In summary, after a TIA, a comprehensive evaluation is performed to identify the cause and reduce the risk of a future stroke. This includes brain and vascular imaging, heart and blood tests, and ongoing monitoring. Prompt medical attention and adherence to treatment recommendations are key to preventing more serious complications. Always consult a healthcare professional for personalized advice and care.